The purpose of this program is to provide you with a better understanding of the medical diagnosis that was given to you or someone you know. This program does not provide specific medical advice. The information it contains should not be interpreted as a recommendation for a specific treatment plan or course of action, and cannot replace the advice of your own physician. What is right for any one person is an individual decision. You should consult with your doctor, who can discuss your needs, symptoms, and treatment.
Our medical director, Dr. C. Everett Koop.
We can plan for and anticipate many things in life, but a health concern is usually not one of them. What I have learned over the years as a physician, as the Surgeon General of the United States, and as a patient, is that understanding a health problem can make a real difference. Over the next 30 minutes, we will take you through the very issues you are probably wondering about right now. By the end of our program, you will have the knowledge you need to better understand what you or a loved one is faced with and what can be done about it. No matter what challenges lie ahead, it helps to be knowledgeable and to stay informed. So stay with us, because we're going to help you do just that.
Hello, I'm Mike Schneider. A stroke is a frightening event for those who have one and for their families and friends. As the name stroke implies, it is a medical emergency that sometimes seems to hit without warning, a bolt from the blue, an overwhelming experience. Right now, there's no cure for stroke, but doctors can reduce the risk of this disease and help those who have had a stroke. Our program is made up of 4 different reports about stroke. In Report 1, we look at how the diagnosis is made and what is going on inside the body. In Report 2, we discuss what happens next. You learn about what kinds of health professionals you may encounter and how your day-to-day life may change. Report 3 explores options for treatment and management. And finally, in Report 4, we address issues that frequently arise. We'll be giving you a lot of information. To review it, use the booklet that comes with this program. You'll find a place to write down questions and take notes when you're with your doctor, and a list of other resources that are available. Now, our first report.
Report 1. Understanding the diagnosis.
It was a very hot day, and I ran about, I think it was 20 to 30 miles that day, and I got very blurry vision. I couldn't see, and my right side went completely numb. My right leg and my right arm just went completely numb.
It was, will he survive? And once we got past that stage, then it was, how will he survive?
1 out of every 4 families in the United States, families like Jane and Graham Butlers, will be touched by stroke at some time in their lives. But there is good news. Fewer people are having strokes, and more people than ever are surviving them.
People that have a stroke are being cared for better in the acute care hospital now than they were many years ago. We also have a lot better techniques for preventing recurrent strokes.
With a stroke, part of the brain dies. It happens when the brain is suddenly deprived of blood, or when a blood vessel bursts in the brain. To understand what happens during a stroke, let's take a closer look at the brain. The brain continuously sends electrical messages down the spinal cord, out through the nerves, to muscles and organs throughout the body. At the same time, the brain receives and processes incoming messages back from the body. This sending, receiving, and processing controls how we move, feel, think, and behave. Specific areas of the brain control specific functions. For example, a specific area is responsible for movement, another for vision, another for hearing, and yet others for speech. All of these brain activities require a great deal of energy. The brain receives this energy from blood. The heart delivers the blood to the brain through several large arteries, known as the internal carotid arteries and vertebral arteries. These arteries divide into many smaller branches within the brain. Here, the oxygen and nutrients carried by the blood are delivered to the brain tissue, providing it with the energy it needs to function.
There are two types of stroke. There are strokes in which a blood vessel has become clotted and caused a stroke, and there are strokes in which a blood vessel has ruptured and caused a bleed.
One of the most frequent types of stroke occurs when a fatty deposit called plaque builds up on the artery walls. This can decrease the blood flow to the neighboring brain tissue, causing impaired brain function. Also, a blood clot called a thrombus can develop on the surface of the plaque and completely block the flow of blood to the brain. Without oxygen or nutrients, the brain tissue no longer functions. This is called an ischemic stroke. Another kind of ischemic stroke is caused by a wandering blood clot, which originates either in the heart or in the arteries leading to the brain. This wandering clot, called an embolus, flows with the blood through the narrowing vessels of the brain. When the vessels become too narrow for the embolus to travel through, it can block the flow of blood. This is called an embolism. Not all strokes are caused by plaque or blood clots blocking an artery. Sometimes a blood vessel may rupture and bleed within the brain or near the brain. This is known as a hemorrhagic stroke. When this happens, the brain tissue downstream from the rupture no longer gets enough blood and oxygen and dies. When an area of the brain is injured by a stroke, there is a loss of the functions that are controlled by the area of the brain where the stroke occurred.
The symptoms depend entirely on what part of the brain is involved with the stroke. If it's the back part of the brain where vision is perceived, the only symptoms may be loss of vision. If it's the hemisphere that controls the strength and sensation on the other side of the body, then paralysis and loss of sensation may be the symptoms.
Okay, let's try vowel first. Vowel. And
Another common symptom is difficulty speaking or other problems with language.
very good. Okay, let's try some L's standing up. Try some L's
The symptoms of
standing
stroke are different for each person.
up. Some N.
Before he had a stroke, Graham Butler had what's known as a TIA, or transient ischemic attack. It's also sometimes called a mini-stroke. The symptoms may resemble those of a stroke, but they often last only a few minutes.
I fell down on the sidewalk and knew something was wrong, didn't know what it was. I went to the gym and got a hold of one of the people in the gym and said, look, something's happened, I don't know what it is. I think I have a question, I need to shower to go back to work. I need some help because I can't stand up.
What a TIA is an absolute warning sign that a stroke is a highly probable occurrence in that patient. And it's a warning sign that needs to be paid very, very close attention to by both the patient and their family, as well as their treating physicians.
In addition to TIAs, other factors may increase the likelihood of having a stroke. These include a previous stroke, untreated high blood pressure, heart disease, diabetes, high blood cholesterol levels, and obesity. Certain behaviors can also increase the risk of stroke, including smoking, heavy alcohol consumption, or lack of exercise. Some risk factors are things we cannot control, like age. Although a stroke can occur at any age, older people are at much greater risk. So are men and African Americans. The risk for a stroke is also higher for people whose blood relatives have had a stroke. A person who has just had a stroke usually begins treatment in the emergency department of a hospital. The first step involves trying to save the patient's life while preventing another stroke and taking care of any other serious medical problems.
The goal of treatment at that point is to prevent further damage from the lack of oxygen to the brain. So We control blood pressure. We keep it from going too low. We make sure it doesn't go too high.
How much do you smoke?
Over a pack a day.
To make a diagnosis, doctors gather information from the patient, family members, or other caregivers. They perform a physical exam and a neurological exam, testing the nerves and reflexes. An electrocardiogram, or EKG, can provide evidence of heart problems that may have contributed to the stroke. Testing samples of blood, urine, or sometimes spinal fluid in the laboratory can help physicians find out whether the person's symptoms are caused by a stroke or by another serious illness that can look like a stroke. Doctors may also order a CT scan or an MRI to get a detailed picture of the brain. In another test known as cerebral angiography, a dye is injected into an artery in the neck, which outlines the arteries of the brain and helps reveal blocked blood vessels on X-ray images. These and other tests help doctors determine whether the cause of the problem is, in fact, a stroke, and if it is, where it is located, and what type of stroke it is. With that information, doctors can move to the next steps: treatment, rehabilitation, and prevention. And patients and their families can begin planning ahead, learning what role they can play in the rehabilitation process. More about that in our next report.
Report 2. What happens next?
The severity of your condition and your overall health will determine what happens next after the diagnosis. The truth is, some things in your day-to-day life may change. You will need to take personal responsibility for scheduling doctor's appointments or remembering treatment plans, and you will want to know what may lie ahead for you.
We want people to understand that we will try as quickly as possible to find out what's wrong with them, that in those initial phases we can't really answer too many detailed questions because we don't have those answers.
Families can focus on what they can control, such as keeping up their strength, supporting the patient and each other, and learning as much as possible about what happened and what they can do in the future. Nurses are often the first professionals patients and their families turn to in the hospital for support.
What we try to do in that situation is to sit down with the family and the patient and talk about their stroke and what it may have affected. Talk about things to expect from the patient, what their goals should be and what to expect. We try to tell them that at any time if they have any questions for the nurse or for the doctor to feel free and to call us or to talk to us when they're here.
After initial testing and treatment, some patients, especially those with bleeding or large strokes, may be moved to an intensive care unit. People whose condition is stable go to another part of the hospital, where they may undergo more tests, including ones for rehabilitation.
I want you to hold your arms up like this.
This is the time for the family and healthcare providers to begin planning for rehabilitation. Teams of skilled healthcare professionals are involved in rehabilitation. To plan effectively, patients and families should understand the roles played by these specialists. Knowing who does what will help you know where to turn when there's a question or a problem. Physicians involved in rehabilitation in the hospital or afterward can include a physiatrist, also pronounced physiatrist. This is a physician who specializes in the rehabilitation of people with neurological or neuromuscular problems.
All right.
Another type of specialist is a neurologist, who deals with diseases of the nerves, brain, and spinal cord. Other team members can include a physical therapist, who works with patients to improve their strength, mobility, flexibility, and endurance, or an occupational therapist, who helps patients become more independent in their daily living skills. But the most important members of the rehabilitation team are the person who had the stroke and his or her family. Families can help make their loved ones comfortable, able to continue enjoying life, and more independent.
we really look to the patient and the families to take responsibility for their own recovery in some ways. We'll teach them how to recover, but we can't make them get better.
I often explain to the families that they should think of a stroke patient learning a new activity or relearning an activity such as walking as being the same type of process that a child uses when he or she learns to walk. It's important to be encouraging and to push the patient, but not too far.
After his stroke, Hattie Grant was pushed by his family to get back on his feet. Now he's glad.
My wife took care of me when I in the hospital and out the hospital. She changed my diet, changed some of my habits, keep an eye on me, make sure I'm not doing too much. When you have a family and you have responsibilities and people pushing you, you know, you face reality.
Rehabilitation usually takes time.
Are we going to have some problems with your right arm being in the way?
8 years after his stroke, Greg Bradford continues to become more independent and continues with his rehabilitation.
I play golf. I ski. I'm gonna be hoping to water ski. I drive my car. I finished college after the stroke. Looking for a job.
Families should be alert to the signs of any future strokes, or TIA.
Family members, as well as the patient, need to pay close attention to any increased signs of weakness, any sensation problems, any new visual deficits, any swallowing problems. These are just common examples of what a patient can experience with a new stroke.
At the first sign of a possible stroke, or TIA, the person must be taken for immediate medical care. Seeing your doctor on a regular basis after a stroke is also crucial.
Most people who have had strokes have underlying conditions that predispose them to strokes, and it's very important to take care of those problems to prevent a stroke, another stroke, and other problems.
Having a stroke affects not only physical health, but also emotional well-being. It's normal for a person who has survived a stroke to feel sad over the problems caused by a stroke. Some people, however, experience a major depression weeks or months later. Graham Butler was a physically active executive when he had a stroke.
The world got very small. That was depressing for me. I was a traveler. My job had me overseas about 90% of the year. And of course, I knew that this was going to have to change, and it did.
Sometimes family members feel helpless, inadequate, or guilty for not being able to do more for their loved one.
It's very important to figure out what you have control over and what you don't have control over. Things that you don't have control over, you need to let go and let other people handle them for the time being. And focus on what you do have control over. Things like educating yourself, educating the patient, being an advocate for the patient, being very supportive, making sure that you're eating and sleeping appropriately so that you can keep your strength up through all of this. Focus on what you can do and let go what you can't do.
Many patients and their families find it helpful to be part of a stroke support group, to be with others who understand what they're going through.
I realize that I'm not by myself, that there are other people just as bad off as I am, and I have a lot to be thankful for. Without the love of my family, I wouldn't have anything.
There are support groups in nearly every community, some organized by local hospitals. In this report, we've discussed how people who have had a stroke, along with their families and doctors, can work as a team to help manage the consequences of a stroke. There are also ways that patients and doctors can work together to reduce the risk for another stroke. More about that in our next report.
Report 3. Treatment and Management.
Your doctor will advise you on what treatment or management approach is recommended for you. It is important that once you have decided on a strategy with your doctor, that you do your best to stick to it. Make sure to take notes on how your treatment seems to be working for you, and let your doctor know how you feel about your progress.
One of the things that I like to emphasize to patients and their families following a stroke is that most patients experience a significant amount of recovery, that stroke is a very treatable disease, and that we can have a significant impact on preventing recurrent strokes.
Many people recover to some degree after a stroke without treatment. This healing process is called spontaneous recovery.
The amount of spontaneous recovery depends on the degree of injury after the stroke. Every patient is different regarding what extent of spontaneous recovery they're going to experience. Some patients after having a stroke have complete 100% spontaneous recovery, whereas another patient having had a stroke may have very little spontaneous recovery.
But what usually contributes most to recovery is an active rehabilitation program.
The good news is patients who have a stroke recover. They get better. They may not recover back to their previous status. They may not achieve full motor recovery or achieve full recovery of some of their memory functions, but you do get better.
Although rehabilitation can't cure the consequences of a stroke, it can improve the patient's functioning and quality of life. Rehabilitation can take place in a medical setting or at home. Rehabilitation starts as soon as possible after the stroke, often within the first few days, and may continue long after the patient has returned home. Therapists usually start patients on a program of range of motion exercises in the hospital to keep their weakened or paralyzed limbs and joints flexible. As soon as they can, however, patients engage in active range of motion exercises. They move themselves.
It's important for people who've had a stroke to continue to have mobility. A limb, an arm or a leg that's immobilized, loses about 5% of its strength each day from lack of activity.
Patients are encouraged to walk as soon as possible.
Imagine a piano player. If he practices 8 hours a day, he's going to do better than if he practices 15 minutes a day. The same is true for the brain, particularly the injured brain. So we want to get that nervous system up to speed as soon as is physically and medically tolerated.
Rehabilitation can also include speech and language therapy. Another aspect of rehabilitation is reducing the risk of future strokes. Taking responsibility for future health means not smoking, eating a low-fat diet, limiting alcohol, and if it's prescribed, taking medication every day to control your blood pressure. Doctors can reduce the risk of another stroke with medicines and surgery. The medicines include blood thinners, such as aspirin, which reduce the tendency of the blood to form clots that can cause a heart attack or a stroke, and anticoagulants such as heparin or warfarin, which also prevent blood clots from forming. For some patients, doctors may recommend surgery.
After a person has had a stroke, it's very important to investigate these blood vessels leading to the brain. Very often, an abnormality can be found, and it's very important to investigate this so that it may be repaired or fixed to prevent a recurrent, devastating stroke.
One surgical procedure called a carotid endarterectomy involves removing the plaque blocking a carotid artery. The surgeon makes a small incision in the blocked artery and removes the plaque to prevent an ischemic stroke from occurring. An endarterectomy is a major surgical procedure that is not suitable for everyone with diseased carotid arteries. Many survivors of stroke turn to substitute activities to replace those they can no longer manage. Graham Butler found his substitute activities in athletics.
I've worked hard since the stroke to physically regain what I could through activities like swimming and jogging and treadmill. I work out regularly now. So I think that shooting to regain as much as I can of what was lost has kept me pretty focused.
Report 4. Issues and answers.
By asking questions and discussing things, you give your doctor a better understanding of your specific concerns, and that's important. Do not hesitate to ask questions. In fact, it might help to write them down beforehand. You are not the first person in your situation to have those questions, and you won't be the last.
Here to talk about issues and answer some of our questions are Dr. Terry Apfelbaum, Assistant Professor of Clinical Medicine at Columbia College of Physicians and Surgeons, and Dr. Laligam Shekhar, Professor and Chairman of the Department of Neurosurgery at the George Washington University Medical School. Thank you both for joining us. Dr. Apfelbaum, let me start with you. What is the likelihood of a stroke after the first one, and how concerned should people be about this?
Patients who have had a stroke are certainly at increased risk for having another stroke in the future. However, the good news is that there are a lot of things that can be done to minimize that risk and hopefully prevent that stroke from occurring. These include lifestyle modifications like stopping smoking, controlling high blood pressure, and we have very effective medications to do that, and in many cases taking drugs like aspirin will prevent future strokes from occurring. If there's an underlying rhythm disturbance of the heart, like atrial fibrillation, where the heart is beating very irregularly, then anticoagulation has been shown to decrease the risk of subsequent stroke. The other important thing to remember is, as we mentioned earlier, TIAs are important warning symptoms of impending stroke. And patients who are having TIAs need to seek immediate medical attention because we have effective therapy, and if we can intervene early, we can actually prevent the stroke from occurring in the first place.
Dr. Shekhar, the subject of surgery to prevent strokes. How effective is it, and when is it appropriate?
A number of patients with stroke may have what's called narrowing of the carotid artery. This is actually a fat buildup in the blood vessels leading up to the brain, which may reduce the flow to the brain or send particles up there that's actually causing the stroke. It's now well established by studies conducted both in the United States, Canada, and Europe that when a person has had symptoms, the operation of carotid endarterectomy, basically going in there surgically and clearing out the fatty buildup, is very effective in reducing future strokes by 2 to 3 times. It must be emphasized, however, that it must be done by a surgeon, either a neurosurgeon or a vascular surgeon, who has a very good track record. He must have a very low rate of complications.
Dr. Shekhar, some stroke patients have had what's called an aneurysm. What is this precisely, and what can be done to treat it?
An aneurysm may be thought of as a bubble that forms at branch points of blood vessels inside the head. And up to 15% of patients who have strokes may suffer a hemorrhage or a bleeding from an aneurysm that causes a stroke. We've made dramatic advances in the ability to treat the aneurysms even after they've ruptured. One way to treat them is to surgically place a clip across the base of the aneurysm, closing it off. Occasionally, when we are not able to treat aneurysms this way, we can actually place a bypass around that aneurysm. Just like you have heart bypass, we can place a brain bypass. A very recent treatment is when the diagnosis of the aneurysm is made, the radiologist or the neurosurgeon will place some coils inside the aneurysm to make it clot off.
Dr. Apfelbaum, something we hear about in the media are drugs known as clot busters to treat heart attacks. What is their role in treating strokes?
Right now, the use of clotbuster drugs to treat strokes is still investigational. These drugs open up blood vessels, they restore blood flow to the brain and hopefully prevent neurologic damage, but they need to be given very early and they carry a significant risk of bleeding. In the near future, I expect that these drugs will be used to treat patients with certain kinds of strokes, provided we can get to them early in the course of their disease.
Dr. Shekhar, earlier we mentioned the importance of family. What advice would you give families who are trying to help a loved one recover from a stroke?
The majority of patients who've had a stroke will have a dramatic and lasting recovery given time, rehabilitation, love, and care. And recovery from stroke is not an easy process, either on the patient or on the family. And the more support the family member can give the family member recover from a stroke, the better it will be. The other thing they might want to keep in mind is the same kind of risk factors that went on to create a stroke in one of their family members may be affecting some of them themselves. Therefore, lifestyle modifications, not just for the person who's had a stroke, but also for the family themselves, may be extremely important.
Dr. Shaker, Dr. Affelbaum, thanks to both of you for joining us. And thank you for joining us. Remember, you can use the booklet that comes with this program to review key points and to take notes. You'll also find a resource guide and a glossary of terms that may be helpful. That concludes our series of reports on stroke. We wish you well.
I hope we have done our job and that you are better informed. The knowledge you have gained should help prepare you for decisions you may have to make. It can also help you sort out any additional information you receive, whether it is from well-meaning friends or the evening news. Facing what you or a loved one is going through right now involves taking personal responsibility. Responsibility for keeping in touch with your doctor and other health professionals and for following their instructions. And of course, responsibility for getting the support you need to cope with certain issues. For all of us with Time Life Medical, thank you for turning to us at this time in your life.
To help you access important information that was covered in this program, you may refer to your personal workbook. You may also find additional information related to your situation in other Time Life Medical videos.